I'm Iris Kassem. I'm a pediatric ophthalmologist at the Froedtert and the Medical College of Wisconsin Health System. I'm also a clinician scientist over at the Eye Institute with a science lab, and I see patients over at Children's Hospital of Wisconsin as well. I received my undergraduate degree at Cornell University in New York, and then I did a combined MD-PhD degree at the University of Stony Brook, over also in New York. I did my internship at Stony Brook University as well. For residency, I went to the North Shore Long Island Jewish Health System in New York, came over to Chicago for fellowship in pediatric ophthalmology. So I normally see children with eye conditions in my practice, but because of my research, I also see adults with a special condition called Fabry disease. I also see children with Fabry disease as well. My special interests are mostly pediatric ophthalmology. I have a special interest in Fabry disease. I also see children with inflammation of the eye or uveitis, and I have an interest in trauma as well as any other pediatric eye disease. For my practice, what I tend to do is I try to treat the children kind of like how I would want my own child to be treated, but also when I'm seeing the patient, everything else in the world is kind of put aside, and it's all about the patient that I'm taking care of at that time. Nothing else is in my mind the second I walk in the room. The great thing about my career is that I get to watch children grow. So one of my happiest days is when I see the children I used to see in the NICU and they read the eye chart, because they are often very sick if they're premature. And then when they're reading the eye chart, they've really come full circle, especially if they have good vision and they overcome a lot along the way. Other things I enjoy, which is sort of the way I run my life, is that my patients give me a lot of questions. There are a lot of things we don't know in medicine, and I often take the questions I learn in clinic, and that's how I run my research lab. And I try to run the research to help improve the quality of care for patients and their outcomes. I love pediatric ophthalmology specifically because the eye and the brain are constantly developing. And it's one of those specialties where if you catch a problem, you treat a problem, and you do a great job, that changes their whole life. So I see pediatric patients as ultra special, and when things go right, I think I get as excited as the parents, if not more.